Are you preparing for SCA? Maybe you feel that you're not good enough, you don't know how to prepare, or maybe you failed the exam last time. If you're finding it difficult, then it's very important that you approach this exam with the right frame of mind. If you're approaching this exam thinking that this is an exam that's not fair, or you don't have a chance to pass, or you have some inferiority complex, then it's going to be difficult for you to score well. Yesterday I was speaking with a GP trainee who failed his exam, and he started questioning his ability as a doctor. Failing an exam doesn't mean that you're not a good doctor. It could be that you were not well prepared, you didn't have the right guidance, or it could be that your exam techniques were not up to the mark. It's important that you have a winning mindset, a growth mindset. Even though at this point you might not be competent enough to pass the exam, what you need to be thinking about is how can you get better? How can you improve your consultation skills? Maybe you have some blind spot or areas of weakness that need to be addressed. It can feel overwhelming when you're seeing another colleague who is consulting and doing it very well, whereas you're at a level where you're struggling to communicate confidently. Take small steps forward. If you improve by 1% every day, over time that's going to compound. So by seeing evidence that you're making progress, your confidence is going to grow slowly. Tip number 2 is to make sure that you're getting constructive feedback. This is a missing piece among the preparation of many trainees who fail the exam time and time again. If you're not getting constructive feedback, you're not going to work on the right things. And also, you might go into the exam making the same exact mistake again and hoping for a different result. So make sure that you're getting trusted guidance and feedback from your supervisor or anybody who's qualified to give you feedback. Are you feeling unsure about the SCA? Maybe you don't know what to do, or you don't know whether you're doing the right thing. If you'd like to get a free copy of the SCA blueprint, click the link down in the description below to get access to the SCA blueprint that GP trainees have already used and passed the SCA exam. It's completely free. Just click the link down in the description below to get access to it. Last but not least is to focus on being patient-centric. If you're thinking about this exam and you're overly conscious about how you're doing your performance, then your focus is going to be more about what question you need to ask, what have you missed, and you're not going to do a good job at consulting. So it's important that, yes, you know that this is an exam and you need to do well. However, your focus needs to be on how you can help the patient. Patients can tell if you're not fully giving them your attention, or if you're saying something but you don't mean it. So it's important to be present in a consultation and listen to what the patient is saying, what they are not saying, so that you can ask follow-up questions and you can show that you understand what the patient is telling you. Otherwise, what happens is that you're going to ask repetitive questions that the patient already told you, and it's going to affect the flow of your consultation. If you find this video useful, you might want to watch the interview with Roger Neighbor, where he goes in much more detail how to develop successful consultation. Click here to watch it. Take care, everybody. Bye-bye.